Back today, a lot of talk in business circles about Warren Buffett's announcement that he has prostate cancer. The billionaire investor writing a letter to Berkshire Hathaway shareholders telling them his treatment begins in July. But those shareholders are now more likely to pressure him to announce who will be his successor, a topic he's been trying to avoid. Buffett insists his condition is not life-threatening nor debilitating.
About 1 in 6 men will be diagnosed with prostate cancer, and more than 2 million men are living with prostate cancer right now, which is a surprising number. Dr. Diane McAllister joins us. She's here to talk about the rate of survival for prostate cancer, and she is, of course, the Chief Medical Officer at Centura's Porter Adventist Hospital. It's always nice to see you.
Good to be here.
Welcome back. You were off last week.
Thank you.
Well, you were working. You were just not with us.
Right.
We're glad you're back. Dr. Diane, Warren Buffett says he's in stage 1. So tell us what that means. I assume it's a good stage in which to be diagnosed.
It is. It's actually an excellent stage. So stage 1 prostate cancer is microscopic focus of cancer inside the prostate gland that you can't even feel or see with an ultrasound. If you go to stage 2, then the cancer is a little bigger, but it's still contained within the prostate gland. Stage 3 is where the cancer has started to come out of the prostate gland into the nearby tissues. And stage 4 cancer is where the cancer has metastasized or moved into other organs such as the lungs, the liver, and the bones.
Wow, so we don't want to get to stage 4 for any type of cancer for that matter. But we mentioned this is the single most common cancer for men. 1 in 6 will likely be diagnosed with it. So what are the chances of survival?
The chances of survival with most prostate cancer are excellent. 1 in 6 men have it, but only 1 in 35 men die from it. Okay. And to give you a little more perspective on that, a stage 1 prostate cancer has a almost 100% survival rate over 5 years. Now, as the stages increase, the survival rate goes down some, but we do have the ability to treat it. And then another interesting fact is that men Warren Buffett's age, about 2/3 who die from other causes will be found to have little foci of prostate cancer in their prostate glands if you look. So it's a common disease and can be a very not aggressive cancer in some cases.
Good.
At some point or another, the conversation usually gets around to early detection. So we want to be testing or screening for these things. What should patients be bringing up with their doctors?
Well, the experts still suggest that men over 50 and over get screened yearly for prostate cancer, first with a digital rectal exam, and then also with a PSA test, which is a blood test. Over the past year, there's been some controversy about the blood test, but experts are leaning on the side of doing the test yearly. Now, if a family member who has prostate cancer, they should probably begin getting tested at age 40. But obviously, they need to talk to their individual doctor to get the recommendation specific to them.
So we're talking about those tests that can help detect the cancer. Are there similar signs, say, like women who have breast cancer may find a lump? Are there other warning signs that men may notice physically?
Unfortunately, most of the signs of there are no signs of prostate cancer specifically, such as women get, but there are some signs. The prostate gland surrounds the urethra, so some of the symptoms men may notice if there's a problem with their prostate gland are difficulty with urination, having to get up and urinate frequently and during the night, and even some heaviness, a sensation of achiness there. So those are some.
Good to know.
All right, thank you, Dr. Diane. Glad that you're back and that you're bringing us these great topics.
Yes, we appreciate it. And if you have a topic you want to see discussed, you can email 11 a.m. at thedenverchannel.com. You can also read Dr. McAllister's advice on thedenverchannel.com as well under Staying Healthy.